Hello, everyone, and thank you for joining us for this important session today on low-tech, high-impact, increasing resilience of small-scale poultry producers in India. I'm Alan Robbins, and I'm Executive Vice President at Devex, where I lead our news partnerships. One of these partnerships we're proud to have is with Cargill, a company we've worked with for years and are excited to have with us again as a partner at Devex World 2020. While it's not exactly a household name, many of you will recognize Cargill as one of the leading food and agriculture companies around the world. When we eat a meal, there's a good chance Cargill is involved. As a business, Cargill's main priority is to make sure we're all fed and nourished, and it works around the world to do that, often leveraging partnerships with local communities and civil society. Our focus today is on one of those initiatives, Hatching Hope, which is a partnership between Cargill and Heifer International to help people grow and strengthen poultry farms, which can actually be some of the best investments smallholder farmers can make. It's a fascinating program that's underway today in India, Mexico, and Kenya, and ultimately aims to reach 100 million people around the world by 2030. To discuss Hatching Hope further, and its work in India in particular, I'd like to introduce to the screen two people who have been instrumental in its success thus far. Dr. Sushmita Parai, a veterinarian and senior project manager for Heifer International in India, and Dr. Jason Shelton, core nutrition director at Cargill. Thank you both for being here. Dr. Shelton, let me start with you. Can you tell us a bit more about Hatching Hope, how it came about, how it works, who's involved, what it aims to achieve, other sort of basic things that the audience might like to know about it before we jump into a deeper dive?
Yep, sure. So, as you mentioned, Hatching Hope is a global initiative co-created by Cargill and Heifer International to improve the nutrition and economic livelihood of 100 million people by 2030 by improving the production, improving the promotion, and the consumption of poultry. It's also, we want to look at the whole food system. For a food system to work, we need to have producers, we need to have a market that exchanges goods, and we also need to have consumers. And so what we do is we go into local communities, we look at the gaps, we look at the strengths of that food system, then decide, where can we add the most value in that system. And then also, in some cases, we're working on all three parts. In some cases, we only work on one or maybe two. So it's really trying to take a customized approach to improve the food system and ultimately improve the livelihood in these communities.
To continue with what Jason shared, when we talk of working with producers, especially smallholder farmers, low-tech solutions is the way to go because they are affordable, they are adaptable, they can adapt to the context, as well as they're easy to learn and operate. So we have seen that these low-tech solutions are extremely valuable in strengthening the system, not only here in India, but also in other countries where we work, such as Kenya, Mexico, and Cambodia. Thank you.
Mm-hmm. Thank you. And Dr. Sushmita, let me continue on that. One of the things that it aims to do is increase resilience of smallholder poultry producers in India. I know that's where you work specifically. Can you explain a little bit further about how exactly it's doing that?
To begin with the context, India has almost 200 million undernourished people, and we have 17.3% of the global population living in extreme poverty. The benefits of poultry products is that they are nutrient dense, affordable, and available. Further, poultry can be a consistent source of income for people with vulnerabilities and limited resources. So the challenge is bird mortality. That can happen due to diseases or due to cyclones or due to predators. Further, there are issues of input supply chain as well as issues regarding accessibility to regular mainstream markets. So what we do in Hatching Hope is we build a resilient poultry system which reduces the mortalities, builds supply networks, as well as works on the market demand through the four primarily low-tech, low-cost, but technically sound solutions. The first is biosecure model poultry shed. So what happened was I got an opportunity, to visit Cambodia and saw the poultry sheds over there were limiting the mortality and increasing production. So after coming back, we adapted the model, but we followed the principles of biosecurity which were there, and we built a system which is rugged to the local extremes of the weather as well as it is biosecure. So, after following this model poultry coup, the farmers had lowered mortalities and increased production. The second intervention or the solution we did is mini feed mills. Now, these mini feed mills help establish the input supply chain for feed. Cargill helped us in it. They came to our field and they processed the local feed resources for protein, for energy, for minerals, and other components. So now we have a formulation which is affordable, easily accessible, and it is highly nutritious. The third solution is trained vaccinators or the poultry healthcare workers. So as a vet, I have trained more than 200 women on the good health techniques of the poultry. So now there is much less mortality and there's more production. But this is not the end of the story. These women are successful entrepreneurs. When they picked up new skill, new knowledge, they've become so proud and so self-confident. And the money which they earn, they have control over it. So they use it according to their decisions to help the family well-being, as well as they have this feeling of serving in the community. The last solution which Heifer has been working on in this project, which is giving very good results, is the nutrition communication campaigns. So the nutrition communication campaign, it builds resilience in the system, A, by creating demand in the market, and that is done how? By making the consumer more aware. So through these campaigns, we aim to reach 1.5 million people, promoting good nutrition for the family, about balanced diet, and importantly, nutritional value of eggs and chicken. We emphasize on pregnant and lactating mothers, young children, and adolescent girls because, sorry to say, but the women are sometimes, the last to eat.
Well, that's fascinating. Thanks for that, Dr. Sushmita. It's a great overview. And Dr. Shelton, I want to move over to you for a moment. Dr. Sushmita mentioned 100 million people. I mentioned 100 million people. What's the plan for reaching that level by 2030?
Well, the easiest answer is to say lots of partnerships to be able to do that. In Hatching Hope, we've developed a framework, really looking at the whole system, as I keep mentioning and emphasizing that system. What that allows us to do is to have different people, different organizations to actually help join us with different expertise to actually grow that system in the local community. We believe in diversity of thought, and so having more and more partners with us will only be able to hit that 100 million. That's the only way we're going to be able to hit the 100 million. Also in Hatching Hope, the framework we've built, it really is replicable to other places. We're talking about India, but we were also in Mexico and Kenya and moving to other places. We have a framework that's able to be replicated, but also customized in that local community. So that's kind of how we're going to do it, is we need partners to really hit that 100 million goal.
Great. And Dr. Sushmita, are you seeing, in your work on the ground there in India, are you seeing particular positive impacts that are going to help get to this scale, that you're seeing as promising to get to this scale?
Yes, 100%. The successes which we have seen till now is that the families are eating 22% more eggs and 67% more chicken meat since the project began. The families who had families who lack access to dietary diversity and good nutrition are also now having more nutrients, particularly protein. Thank you.
Mm-hmm. Great, thanks.
And Alan, just to add to that we've seen, talking about some of the solutions that Dr. Sushmita had mentioned, we've seen a 233% increase in poultry cells in the last 12 months. And also those micro meals, we have 20 of the micro meals that are up and running, run by local farmers and strategically located so people can efficiently get to there by walking and get the food and feed back to their animals too. So there's two other examples of what we see as promising that so far is working.
Mm-hmm. Great, thanks. And Jason, I'm going to continue with you for a moment and ask about challenges. What sort of challenges you run into so far? What have you done to overcome those? How do you see them happening in the future?
I think the biggest challenge that we've seen is really maintaining momentum when you have early setbacks. And the example I would give would be in India, where we've had 2 cyclones, suspected avian influenza, and COVID-19 that we're all dealing with, and not allowing those early setbacks to really change the long-term vision that we have for this project. It's also allowed us to go in and try some new things, try some areas that may work and not work to really make resiliency in this program really the priority. We're in this for the long term, so we're in it till 2030. So being long term also allows us to have some accommodate for some of these setbacks early as well. Some of the positive things we've seen out of that is we have seen where the Hatching Hope farmers have done better than farmers that are not on the Hatching Hope program during this time of setbacks and different disasters that we've run to. So we see some positive signs, but just to answer your question, it's not allow early setbacks to really derail the program that you have in place.
I'll move over to you, Dr. Sushmita, about kind of lessons learned, and not just lessons learned, but what the others in the Devex audience that might be watching this today, what you might be able to give any wisdom to them about how this thing is going and how they might address their partnerships in the future.
We think that thinking outside the box is the key. But what we have learned is sometimes thinking of things which are not related to the box also matter a lot. Like this COVID-19, which Jason is mentioning with our farmers. So we were there in the ground and we saw how desperate the situation was and we flagged it. And Cargill came in immediately with the relief which was needed beyond our project goals. So you see, this synergy, this complementary, this thing is very much needed in partnerships to succeed, and it has enabled us to survive through this COVID-19 from the community perspective.
Yeah, Alan, if I can just add to what Dr. Sushmita said, I would say 2 pieces of advice I would have too is one is look at the culture. We talk about culture, and I know organizational health talks about culture, but I think working with a group and a partner that has the same values and cultures is very important. And between Heifer International and Cargill, we've been able to see that on the ground with the example that was just shared. So that's one thing. The other thing is just the systems approach, again, allows for really looking at the whole system, but also adding partners to be able to reach that goal that we've talked about. And so I would just say if anyone wants to talk more about Hatching Hope or wants to learn more or want to be a partner, we would love to hear from them as well. So those are just 2 quick examples of just added to what Dr. Sushmita said.
You mentioned, Dr. Sushmita, those 4 areas, and if I can go over them briefly from my notes here again, I'll just remind the viewers. Model poultry houses designed to reduce bird mortality, microfeed mills. Let's see, we have is the 3rd one here, so I want to make sure I get this right. Home mix nutrients, and then nutrition communications campaign. Can you share with us how these can be, are these things that can be transferred and adapted to other program areas, maybe even other projects?
Yes, you've captured all 4. The trained vaccinators or the poultry healthcare workers are also one of them. So you see, all the things you listed, all 4 of them are on topics that are important across all farming systems. So I will take, for example, the model poultry shed. Now you see, any smallholder farmer who rears a sheep or a goat or a pig is bound to benefit from this. Why? Because it builds biosecurity. Today, there is zoonosis, there is infectious livestock disease. We all are concerned about it. This model can be adopted by anybody, any country, where the community, the smallholder farmer, is dependent on the livestock for their income and for their nutrition. If they adopt these, the system will become resilient, and the farmers, anyone, can protect their animals, ensure their animals are healthy, ensure they get optimal diets, low cost, affordable at the nearby place. And also it is sustainable and resilient because there is demand at consumer level, because we are also working with the market.
Well, with that, I think that we're coming close on time, but if there's one thing that each of you could say in 15 seconds or so about whether it's about the program or whether it's about how to become involved in the program, what would it be? And Jason, I'll start with you.
My one thing is we do have an ambitious goal. It's a big impact, and we need partners. We want to have people that would join us in this journey. So my big ask is to learn more about Hatching Hope. Reach out to us, and we're willing to share and open it up so we can actually hit this goal of 100 million people.
And Dr. Sushmita, I'll move over to you.
You want to work for women, you want to work for nutrition, you want to work for animals, welcome. This is the place to be.
Well, I think everyone here at Devex World does. So I want to thank you for this and to learn more about this great program. I encourage everyone who's in the audience to reach out to Dr. Shelton, Dr. Sushmita, if you have any questions or would like to be involved in the program, think you have any good partnerships ideas. I learned a lot, and I want to thank you both for being here. And I want to thank everyone in the audience for watching this and listening to this. And I hope you enjoy the rest of your day at Devex World.